For women contemplating breast augmentation, there's something new to consider. There is a softer, longer lasting, and safer implant that's now available in the United States. In Fort Myers, Florida, we spoke with Dr. Robert Brueck of Associates in Cosmetic Surgery to learn more.
Basically, there are two types of implants. There's saline, which is basically a shell, a silicone shell, and it's filled with saline or salt water. And then there are the gel implants. And the cohesive gel implant, one plastic surgeon on the West Coast called it a gummy bear implant. And I think it's a good analogy because most people in the audience and people watching the show today have had gummy bears. If they haven't, their kids have. And when you take a gummy bear and you cut it, you have two distinct pieces. And the gel, i.e. the gummy bear, doesn't bleed or leak. So in the same way, if you take a new cohesive gel implant and you cut it, the gel will stay in the capsule, in the shell. So we call it cohesive gel gummy bear implant. There are many women that come in to see us for a breast augmentation. There are those women who have very little tissue, very little skin, small, thin muscles. For those people, having a cohesive gel implant is almost mandatory. On the other hand, you have a woman that'll come in who has a moderate amount of breast tissue already. She's had maybe a couple children, she's a B cup, she's got some laxity, and for that patient, they can either go with saline or with the cohesive gel implant. They'll get a good result. So the less tissue a person has, I think it's far more important to go with a cohesive gel implant.
We asked Dr. Brueck, what are the advantages of this implant?
When women get a breast augmentation, I usually see them like 6 weeks post-op. And many of them will come in and they will have seen their obstetrician gynecologist, and he does an examination, and their own doctor doesn't even know they have a breast implant in because it's soft and natural. And I hear the comment a lot of times from patients, I only wish I'd done this 5 years ago or 10 years ago. Here's a young lady that came in to see me wanting to enhance her breasts. She was about an A to a B cup, not contemplating any more children, so we took her to the operating room. We did a breast augmentation with the gummy bear implants. And this is the result she has post-op. She's very happy, very thrilled, and it's given her the body and the self-image that she's always lacked after having her children.
We ask how a woman can know which implant is right for her.
When it comes to size, I tell women that I'm going to make you as big as I can, but yet so you look natural. So when you put on a halter top, when you put on a bathing suit, when you put on a blouse, you look very, very wonderful. You have a nice figure, a nice silhouette. You don't look overstuffed, if you will. And when I do a breast augmentation, I will, at the time, in the operating room, have 4, 5, 6 different size implants in the operating room. It's not like one size fits all. So after I make the pocket, I then will put in different sizers, 250, 275, 300, till I give one and get a size that gives good cleavage, proportional to the body. And one thing I have learned over the 30 years, women adjust up easier than they adjust down. In 30 years, I've never had a woman come in and say, can you take these out and put me in smaller implants? They're too big.